Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended with this really soft, mushy, glutinous wax right up against the eardrum. And these are the procedures that I kind of least enjoy, in the sense because they are the most challenging, but I also enjoy the challenging cases. It's a strange paradox there. These are the really, really tricky ones. It's not because of the consistency of the wax. It's not due to the ear anatomy almost, really. Although the entrance of the ear canal is a bit narrow, and that's why I'm mopping up some of the entrance, because I'm going to have to stretch open the ear using the endoscope in a moment. And to stretch this ear canal open, the endoscope is going to be almost in this position here. So I'm just clearing some of this debris. So the endoscope tip doesn't get smeared when I then insert it and dilate. But when you've got this kind of consistency against the eardrum, it's very difficult to suction. And also, I just don't know how thick this layer of wax and dead skin is. Now, I did ask the patient whether they used a cotton bud, say a cotton swab, as I believe it's known in the US. But they did deny it, but they didn't seem too confident when in their denial, and something about their body posture, and they kind of almost gave me a little side eye when I asked them, tells me otherwise. And so does the appearance of this, because you can actually see indentation right in the middle. So I'm just cautiously, very cautiously now approaching this, because I just don't know how thick this layer is. So what I'm trying to do is reveal some of the eardrum. Once I can reveal some of the eardrum, it's going to then help me decipher how much margin of error I've got, really, before I come in contact with the eardrum. Now, some of you may be wondering why I'm not peeling it from the sides. I'm going to try that, but it's just too soft. So sometimes if you've got more crusty, dry wax, if you start peeling it from the perimeter, it will then go towards the eardrum. But here it's just way too soft. And you'll see that in a moment, so it's not peeling away. Now, I've got some really interesting comments from yesterday's video, and I want to address one of those and give a response, because I think it's a really good question. So yesterday's patient had this collapsing ear canal. So when I entered using the full zonal suction probe, what was happening was that suction power was causing the canal in the midsection to collapse. So I then had to revert to the fine end suction probe. And some people ask whether it's possible to almost pause the suction or reduce it, enter the full suction zonar tube past the point in the ear canal where it was collapsing, and then release the suction power so we get the full suction power. Now, you can do that in several ways, and I'll explain the pros and cons, and I'll explain something that I'm in the process of developing in the background. So yes, you can adjust suction power. So the way you can do that is you can actually turn down the suction power on the suction pump itself, but that would be very impractical in that procedure, because I wouldn't be able to adjust it whilst performing the procedure, at least manually on the suction machine itself. So an alternative is a suction foot pedal. So they are available, but it's extra kind of hardware, if you like. And because you're looking at such small changes in suction, your foot movement, sometimes it's going to be very tricky to get that exact amount of suction power. But that is one plausibility. But again, it's just extra hardware, extra soft, extra wiring. Again, it's not always practical, because we're looking at kind of small changes in suction power. So there are suction tubes where on the handle there's a fenestration, so there's a hole. And the idea is if you have your finger on the hole, you have max suction power. So in that case yesterday, what one option would be is to have my finger off the suction hole, go past the swelling where the canal was collapsing, and then, so that reduces suction power. So when your finger is off the hole, the fenestration, the suction probe has got two air inlets. It's got the inlet from the tip of the suction of the probe that you can see on screen right now, and you've got a second inlet on the handle. And that means air from both sides is competing for the internal capacity of the suction handle. So it basically, because you've got two inlets, it means that the suction power is almost halved from the tip, because it's being outcompeted by the inlet from the handle. I hope that made sense. And then, so I have my finger off the handle, well, of the hole, go past that midpoint of the canal where it was collapsing, and then once I'm past that, I can put my finger back on the hole to close that second inlet to maximize the suction power coming from the tip of the suction probe, what you can see on screen right now. And I've got those suction probes, but I tell you, they are so difficult, for me at least. So as soon as I take my finger off that hole, I feel like I've lost grip, I've lost control of the suction, and it's so difficult for me to go back on it, on the hole. So for that reason, I'm not a big fan. I know some people are very good at doing that though. So I know one of my colleagues, he's really developed that technique, but I struggle a bit, if I'm truth be told. So I have developed a new solution, and I've applied for my patent. So with everything else going on, I've almost taken my eye off the ball with that. But yes, I have applied for a patent, and so I can talk about it a bit more. So it's a suction handle where you can regulate the suction power by using your finger, but your finger is always on contact with the handle. So it's almost like, I'm trying to think of the best way of describing it, but by applying pressure with your finger onto this handle, you will increase suction power. And then just by releasing pressure off the handle using your finger, you're going to reduce suction power, but your finger is always in contact. Probably the best way, I'm sure there's another analogy, but it's almost like a spray can or deodorant can. You push down, you got max suction power, and I'm working on a lock mechanism there as well. So if someone doesn't want this ability to regulate suction power and they just want full suction power, then you don't have to apply pressure per se. You can just lock the handle in place so it's constantly giving full suction power. But then there's a release valve where you can unlock it, when this handle, it's like a piston, it goes up and down, but your finger is always on there. So you don't have that issue that I was describing when I used the whole suction handle, where I have to take my finger off it to reduce suction power. So I've applied for the patent, I've had prototypes made, and they do work, which is really, really good. I was really unsure if it would work because it's quite a complex design. Once it's in manufacture, it's not so bad, but just getting the design, because there's kind of the tolerances are quite small there. And there's a bit more work that needs to be done on it, but I'm really pleased with the prototype. So the concept definitely works, which is great. But I've just got so much going on with the Waxscape and all my other instruments that I've just been preoccupied with that. But I will talk about that in more depth. And so it's not only going to be useful, I feel, for earwax removal, but maybe other types of procedures where suction's used. For example, during surgery, where a surgeon is suctioning blood, but you may be close to an important organ or an artery or any delicate tissue where you don't want to have too much suction power, and then have sort of using a foot pedal or turning it down on the machine, or having this hole. You can just manipulate it by using your finger, but your finger is always in contact with the handle, so you're not losing control of the suction, which is so important. So it has got potential alternative uses as well, not just for earwax removal. And also with the suction handle with the hole, when you have your finger off the hole, you're actually increasing the noise level at the higher frequencies. So it's quite a strange one. You're reducing suction power, but you're increasing noise, because when air enters that second inlet on the handle, it creates a high frequency squeal. And I've measured this. I've put microphones in patients' ears or in fake ears, and also I've done it in real ears. I've done it in my own ear actually, and there is like a 15 to 20 decibel increased noise level when you have your finger off the hole, but then the suction power is about 20 to 30% less, so it's an inverse proportional relationship there. So with the design that I've developed, as you decrease suction power, you also decrease suction noise, which is so important. I feel that's going to be more relevant to ear procedures. Other parts of the body may not be that relevant, although this noise is also allowed for me as the practitioner, so actually it may also have benefits for other disciplines. Sorry for going off tangent there, but no, it was a very good question. I should have probably addressed that in that in yesterday's video, but yeah, I will discuss that in more depth in due course, and I will also hopefully show some pictures of this new design that I've developed with my prototype, which I've got somewhere lying around in my drawer. Sorry, we've probably ignored some of this procedure, but I put some sodium bicarbonate drops in, which works much better with this type of wax. I must be honest there. Although I prefer olive oil, but with this mushy stuff that's got a lot of keratin content, which this has, I do prefer sodium bicarb. But I didn't put too much, just enough, just to soften this. This patient's going to use some acetic acid spray to help re-acidify the ear, because sodium bicarbonate is slightly alkaline. This patient does suffer from itchy ears, so I'm just trying to get as much of this mushy wax and skin off the canal wall, but I'm not going to manage all of it because I'm just going to scrape the ear canal, and I don't want to do that. And that's going to then cause other issues. I could cause bleeding, pain, lacerating the ear canal can then give rise to secondary iatrogenic infection, which we don't want. So I'm just hovering over. I'm pleased with that. So is the patient. That's the main thing. So again, all this thicker, chubby lumps of soft wax I can just about get, but there's going to be some residual remaining wax there. Well, I hope you enjoyed that video, guys. Do take care, keep well, and speak soon. Bye.